Okay, we're going to finish up the semester with hallmarks 8 through 10. This is a fairly quick presentation. And in fact, I'm going to jump to the end real fast because I want to first start with the microtumor environment, which according to this paper is right at the end of the discussion. Okay, so in the book, we kind of reviewed what the microtumor environment was, but just a really quick overview. So there's two types of environments I want to focus in on this picture, but overall, the microtumor environment is everything that you would find around the tumor. Now, in this picture, we see there's an oxygen gradient, and out here, there's lots of oxygen. So there's lots of oxygen, so high level of oxygen on the outside of the cell, or the outside of the tumor. But as you get closer into the middle, it becomes more of a hypoxic environment, so there's much less oxygen. Similarly, we have a change in pH that's happening. So on the outside, it's going to be more basic, but as you get towards the middle, then it's going to be more acidic. So we have an environment in the inner part of the tumor that is acidic and hypoxic. And then as you go to the outer part of the tumor, it becomes more basic and the normal level of oxygen. Okay, so this is just showing you how cells within the microtumor environment will change a lot. So we know that cells will try to regain mobility, and leukocytes or other white blood cells have the ability to move around, and it's just changing the environment to suit its needs. And here in this picture, again, kind of showing similar, we're seeing in the middle we have a hypoxic area, but it's also kind of showing you the different levels of certain cells, the fact that there are fibers involved, and then where levels of certain proteins are higher and lower, and that will yield one of the different hallmarks we're actually seeing on this page. So there's a lot that goes into the microtumor environment that the tumor itself adapts to two levels of the environment, the outer part and then the inner part of the tumor. Okay, so with that, we'll go back to the beginning slowly. Someday we'll get there. Okay, so hallmark 8, tumor promoting inflammation. Basically, this is just saying inflammation can cause a tumor, or creates the environment that might cause a tumor. It's an environment that, depending on how long the inflammation is there, increases your susceptibility to cancer. So what's the inflammation? Usually it's due to an injury, but can also be due to a disease like cardiovascular disease, things like that. We know acute inflammation, which is short-term inflammation, is your typical redness, pain, warmth, swelling. All of that's due for two main reasons. It's trying to get white blood cells to that area to repair when it's an injury, also to provide pain, so you stop messing around with that area and you let the cells do their job. And that is, again, acute is short term. It's when we hit chronic long term inflammation, that's when it makes the environment that is better suited for either mutagenesis or for the growth of the cancer. So what is chronic inflammation more about? Well, things you'll see: fatigue, muscle aches, changes in the gastrointestinal region, possible weight gains, headaches, and skin rashes. But you can see here that chronic inflammation is linked to a lot of different diseases. Of course, we're more interested in cancer. Okay, so again, having an area on your body that is inflamed over time and usually it's systemic inflammation, will increase several levels of the tumor. So even just starting the tumor to the growth of the tumor, and then progression through the different levels of tissue, finally then to movement. Okay, so why is this happening, and what is the normal reaction to inflammation? So what should be happening is that, I'm going to start with this one. So here's what the area should normally look like. We're seeing some signals, some cells swimming around. In this figure, we've got some type of injury. It says injury, tissue disruption, infection. And so you see lots of white blood cells going to the area, releasing cytokines that are going to create an area of inflammation. The goal when this happens is to go back, once everything, like you've taken care of the infection and the wound healing's all better, is to go back to this state where there's not a lot of white blood cells floating around. Now, what if this was long term? So now if we change this to chronic inflammation, then what we're doing is we're creating this environment long term, and that starts the progression, the likelihood of a tumor. And then if it's even long past that, then you're starting to go into metastasis, and look, it can even cause multi-drug resistance. So it's best to get inflammation under control. A lot of inflammation can be linked to obesity. So just the normal recommendations that any health official would say: healthy diet, exercise, proper amounts of sleep. Down here, we just kind of show how the pathway for inflammation would lead to the tumor microenvironment changing, and so we're getting a lot of immunosuppression, which we'll talk about when we talk about evading the immune system, right? And so we're creating a different environment. We'll talk about metabolic regulation changing, and ultimately that just leads to a great area for a tumor to grow. We go over to this figure. It's got the same idea going on. Here we have the injury, the short-term injury, where you repair it and everything is good, the proper amount of growth, and now we're back to normal. Or you have the chronic condition, so you've got a lot of white blood cells in the area over time, which are releasing a lot of those cytokines, whose job is to create the inflammatory response even greater. And so this is common. If it keeps happening over and over, then we're creating that great opportunity for a tumor to grow and move. Okay, so in this figure, I just wanted to kind of show you a marker that they tend to use and has been known to increase with cancer in the inflammatory pathway. So there's this protein called C-reactive protein. There it is right there, CRP. It's this red, it's just a signal that we have in our body, and it binds to this receptor, Fc gamma receptor,